Every day, every single day, things are happening in the world of deals and deal makers. And there's never enough time to keep up with every company, transaction, announcement, or whatever. It's just exhausting. And we have a new product to help fix that. This is Axios Pro Deals, a new premium subscription product bringing you tailor-made insights like never before. For the last 5 years, Axios has helped deal professionals navigate the whole deal landscape with Pro Rata. With Axios Pro Deals, we're diving deeper into the industries that matter most to you. You just want stories on fintech? There's a newsletter for that. MedTech deals? We've got you covered. The future of retail? We'll guide you. With Axios Pro Deals, you're going to be getting all of this industry-specific insight and expert analysis at a level you simply can't get anywhere else. So if you're a venture capitalist, private equity investor, banker, trader, founder, executive, anyone who cares about deals, Axios Pro is what you need to help you understand what matters and why. Start your free trial today at AxiosPro.com.
Welcome to our Vitals Checkup virtual event. I'm Caitlin Owens, healthcare reporter at Axios, and I'm joining you from our office in Arlington, Virginia. Welcome to our audiences on Facebook, YouTube, Twitter, LinkedIn, and on Axios.com. You can join the conversation today on Twitter with @Axios or #Axios events. Over the next 30 minutes, I will be joined by my colleague Victoria Knight, and we'll explore the future of telehealth policy after the midterms and heading into 2023. Our first guest today is the Congresswoman representing Washington's 5th Congressional District, Congresswoman Cathy McMorris Rodgers, joining us today from Washington, D.C. Welcome, Congresswoman.
Thank you, Caitlin. Great to be with you.
So let's start off our conversation today. Telehealth kind of by requirement, by necessity, became rapidly adopted during the pandemic, basically overnight at the beginning of it. And since then, it's been very popular among members of Congress, and it's one of those rare bipartisan issues. Can you talk about what over the past few years has happened to make it such a popular issue?
Yes, well, it is an exciting telehealth renaissance that we are experiencing right now. I do think it's important to reflect that telehealth had been around in a limited way for decades, but most of that had been, had been outside of Medicare. So Medicare is the fee-for-service system, and most of the innovation and the patient benefit behind telehealth had been outside of traditional Medicare and the employer-sponsored insurance and the Medicare Advantage programs. And there's just more flexibility, more personalization in those programs. But unfortunately, it took us really a global pandemic for us to realize the larger benefits of telehealth and really to introduce telehealth into traditional Medicare. And this started way back in the spring of 2020, near the beginning of the pandemic. At that time, we were telling hospitals and providers to cancel appointments and stop most of the in-person non-COVID care. And we needed a way to provide healthcare to millions of Americans. And that was when CMS said that we were going to loosen up the restrictions to let telehealth fill that gap. And that was introduced in bipartisan legislation broadly in the CARES Act, and really allowed us to address growing demand and need to allow for Medicare fee-for-service to pay for telehealth and to also provide more flexibility within Medicare Advantage. And so, that's where it really the gas pedal was put on, and telehealth now is to your point, it enjoys broad bipartisan support. And I think people in Eastern Washington, the patients that I have talked to, as well as my colleagues across the country, are telling us that patients have been happy with telehealth, the telehealth that they have received, that they have appreciated being able to be connected to a doctor without having maybe to go to an in-person, especially during COVID. But you think about the person who has a cold or maybe a more minor healthcare issue, being able to connect to the provider without having to get the appointment. But in an area that I represent that is rural and patients might have to travel further distances, being able to connect electronically can be a game changer and really make a difference in getting people the care getting access to care quicker and addressing those healthcare needs in a way that's going to serve people better. So, I think this is it took a pandemic to really jumpstart telehealth, but now both providers and patients are responding positively. And so right now it's tied to the public health emergency. And as Congress is considering the telehealth provisions and how to make, or what provisions to make more permanent, we're looking at how to transition beyond that public health emergency, which I hope we will see come to an end early on in 2023, and with that, more permanent direction for telehealth.
Yeah, that's the perfect segue to what I was going to ask you. Is I know the House has done, specifically the E&C committee, has done a lot of work on extending or making permanent some of these telehealth flexibilities. Can you drill down a little more specifically into what exactly it is that y'all want to make permanent or extend?
Yes. Well, I think first and foremost, we want to delink the telehealth flexibilities from the COVID-19 public health emergency. And so that's step one. We want to make sure that patients remain in control of their doctor visit decisions, and that it's the patient that is deciding whether or not to utilize telehealth services, or if they prefer to see a provider in person. We're also having broader conversations about the guardrails on the program to make sure that we are cutting down on potential waste, fraud, and abuse, which we will see that in any program. But we need to create a permanent structure around telehealth, and that is, right now we're working more on a short-term bridge policy to give us some time to consider what those guardrails would be and where the maximum efficiencies will be. At the beginning of well, and at the beginning of the pandemic and during the pandemic, there certainly was a big spike in telehealth visits. Now that people are able to return to the doctor's office, you see where that is leveling out. And so I think it's wise for us to spend a little time really assessing how this makes sense and making sure that we condition it in the way that's going to provide the best care to patients and giving them the option when they want to take advantage of telehealth.
Right. And I do think it's important to talk a little bit about telehealth and mental health care, because I know that's been huge in the pandemic era, especially with such a high demand for mental health care. Do you think that that's here to stay, the kind of mental health care being more of a virtual than in-person thing?
I do. I do believe that we will address the mental health provisions also, because we've seen during the pandemic that being able to connect in getting access to a provider in a quicker fashion, and especially I've certainly heard the stories in Eastern Washington of those who needed access and were able to get that access quicker. And if it's a mental health issue, when someone is needing that care, especially if it's an emergency situation, being able to connect with a provider quicker. And the providers have told me that it's helpful to be able to see a patient or an individual in their home, or be able to see what their surroundings are, and to be able to do that virtually makes a lot of sense to me.
Right. And I like how you framed this, what you're working on now, as kind of a bridge to a more permanent telehealth infrastructure. But as we're talking about this bridge, obviously there's a lot up in the air right now with the end of year spending bill and what that legislation is going to look like. Can you talk a little bit about the prospects that that kind of bridge package gets added onto that end of year package?
Well, I think it would be a big win for the American people for us to be able to come to an agreement on a bridge on telehealth. I would highlight that there was a bipartisan bill that passed the House, a 2-year extension that included a lot of flexibilities. Over 400 representatives in the House voted for that legislation, and it provides the certainty around Medicare paying for these services, and it also offset the cost. So I think that the House has done some important work on this. I'm going to be pushing to get as much of the House bill as possible into a year-end package, if that should all come together.
And if it doesn't come together for the year-end package, does that punt it to next Congress? And I mean, regardless, you're kind of looking at leading the E&C committee next year. Are there other telehealth priorities that you're interested in pursuing, regardless of what happens at the end of the year?
Well, telehealth is going to be, whether it's a bridge, whether we get something attached to the year-end package, we will be doing more work around telehealth and making some longer-term decisions. I'm believing that the public health emergency will come to an end early on in 2023, and we will be in a position where we need to pass a longer term bill around telehealth. And I would keep encouraging the Senate to look at the House bill that passed earlier this year with over 400 votes, and hopefully the Senate will see that as a measure that would make sense in the short term.
Right. So I guess it's anyone's guess what happens over the next few weeks, but it sounds like there's a lot more to come in this area next Congress.
It's an exciting time in really opening up this type of access to people, to be able to connect with providers. I think about Eastern Washington and being able, not just no matter in a rural area, but to be able to connect with specialists across the country, for example, to help meet your healthcare needs. That is a huge game changer, and certainly an idea whose time has come.
Well, with that, we're out of time. Congresswoman, thank you so much for joining us today.
Great to be with you. Thank you.
And next, we have a view from the top segment with my colleague, Chris Freites.
Thank you for joining us, and thank you to our sponsor. CVS Health, for making this conversation possible. And joining me now from CVS Health is Dr. Craig Milford. Dr. Milford is the Senior Vice President of Retail Health, and he oversees the CVS Minute Clinic, Health Hub, and Virtual Care. Dr. Milford, welcome to Axios.
Pleasure to be here.
So I'm really excited to talk telehealth with you because I think a lot of people, myself included, really got used to seeing our doctors virtually during the pandemic. We'd like it to continue. And we know that when Congress eased restrictions on telehealth, it made it far easier for people to get the care that they needed when they needed it. And now consumers are demanding more immediate access to care. So I wonder, is telehealth the new standard for healthcare? And how is CVS Health thinking about meeting that consumer demand? And what do you need to do it?
Yep, there's no doubt that the pandemic completely accelerated telehealth services, to your point. Funny enough, in a recent survey I looked at, consumers really believe, 72% of consumers believe that the quality of care from a virtual visit is as good or better than an in-person visit, which is astounding relative to where we were a couple of years ago. Consumers want their healthcare delivered in a more personal way. And, what I think CVS wants to see is how do we continue the reimbursement strategies through Congress and CMS and others to ensure that we're meeting the needs of our consumers.
And I think, consumer demand is up, and we're seeing providers on the other side really adopting telehealth faster than we ever have before. So I'm wondering, do you think that continues, that trend? And how has telehealth changed the way that providers treat patients? What are the benefits?
So providers really, pre-pandemic, did not utilize telehealth all that often. I think three things changed through the pandemic. Number one, the workflow for providers in terms of being able to schedule and integrate a virtual visit into their daily workflow was a key unlock for providers. The second is what we just touched on related to reimbursement. So many of these services previously were not reimbursed, and today they are through virtue of the unlock of the pandemic relief funding. And then third, I think probably most important, there was a question of perception of the provider if they would think a virtual visit is as good of care to deliver to their patients as in person. And we have several studies, one that I looked at recently, 75% of physicians say that telehealth allows them to deliver as high quality care as an in-person visit.
So both consumers and providers saying that the quality of care is just as good, it's more convenient. And I think one of the most exciting things that we saw during the pandemic was the explosion of telehealth to make mental health care more accessible to folks. And I wonder, why is telehealth so important to addressing this nation's mental health crisis? And how can virtual visits really benefit patients looking for mental health care?
Well, we had a shortage of mental health providers pre-pandemic, and that was only exacerbated through the pandemic, as we've seen. On the utilization for services within telehealth, we continue to see behavioral health services far and away be the highest utilized service. There's a couple of different reasons for that. Number one, within the provider and patient relationship, we do know that you don't need an exam. It's a lot of conversation with that patient. Telehealth is a perfectly suited platform for that. Number two, really speaks to the privacy and security for those patients and the stigma that can sometimes come with depression and anxiety, whereby a telehealth visit performed in the comfort of a patient's home is probably better for that patient and their ultimate engagement with the provider and with the system than being in an exam room or in a office space with another provider. So that privacy security of performing these visits when and where the patient wants to, within the security and privacy of the space that they choose, is actually really important for mental health and accessing mental health.
No, I think that's right. And we're seeing the demand, but I think that one of the big questions is affordability, right? Is telehealth making healthcare more affordable for consumers and for the healthcare system writ large? I mean, bottom line, are we going to see costs increase as we see more telehealth, or does it keep costs in check?
I actually believe, I think our data is not quite where we all want it to be in terms of answering this question for good. With that said, there's several case studies and examples that we look at, or I look at, related to, number one, these visits are actually pretty affordable. They're all priced on the web, and consumers can see the price transparency. Number two, it's much more affordable than going to a local emergency room or urgent care facility, just in terms of the cost, both for the patient and the system. And I do believe that over time, we'll continue to see, as these types of virtual visits are introduced and correctly coordinated with the in-network providers, that we'll see significant savings for the system.
Now, finally, I want to talk a little bit about what CVS Health is doing, because you have talked a lot about this integrated model with integrated coordinated care. And of course, telehealth and virtual health play a big part of that. And I just wonder, tell me a little bit about this model. What's the biggest benefits of it? And how are you building these services out for the future?
So CVS strongly believes in our consumers and delivering a great consumer experience. Within that, for the retail health segment, which is, as you mentioned, Minute Clinic, Health Hub, and virtual care, we strongly believe that delivering these services omni-channel, whether that patient wants to receive care from us in person, digitally, or virtually through a video visit, I think is remarkable. And being able to tie those together so that the consumer can get care when and where they want it is critical. The second thing that we're working on as retail health is ensuring that we're moving from an episodic interaction with our consumers to one that's a trusted relationship over time. And so you're going to see more and more initiatives from retail health related to ensuring that we're creating relationships over the long term with our consumer base, which we know we already have, given the brand of CVS. One thing that we'll be launching is CVS Health Virtual Primary Care, which we're incredibly excited about, which is really the prototype of creating longitudinal relationships with a physician-centered care team for the patients that we serve. So excited about our launch of virtual primary care come 1/1/23.
Looking forward to seeing that, and we'll have to leave it there. Dr. Craig Milford is the Senior Vice President of Retail Health for CVS Health. Dr. Milford, really enjoyed the conversation. Thank you so much for joining us at Axios.
Thank you.
And now, your next segment.
Thanks, Chris. I'm Victoria Knight, healthcare policy reporter for Axios Pro. Our final guest is the Congressman representing California's 5th Congressional District, Congressman Mike Thompson, joining us from Washington, D.C. Thanks so much for joining us, Congressman.
It's my pleasure, Victoria. It's good to be with you.
So to start off, Congressman Thompson, you and several other members decided to start the Bipartisan Congressional Telehealth Caucus in 2017 before COVID was anywhere on our radar. Tell me about that decision and what made you all realize this was something important to do for the future of medicine.
Well, Victoria, I've been working on telemedicine, telehealth, since I was in the California State Legislature. As a state senator, I saw this as a means by which to deliver health care in traditionally underserved areas. And there's just a ton of examples as to how well this was working, how important it is. And so when I left the state Senate and came to Congress, I brought with me the desire to continue to expand telemedicine. And so I've been working on it the entire time I've been here. We've had some situations, probably most notably from my district's perspective, were some of the fires that we had in my district and throughout California. And things were so tough that a lot of local doctors were providing health care through telemedicine, knowing that they wouldn't be reimbursed for their services. They were just doing it because the work needed to be done. And that really motivated me to step up our efforts to expand telemedicine. So when COVID hit, it was a no-brainer. We needed to do this for all the obvious reasons. The last thing you wanted were people who were frail or susceptible to have to go into a clinic or a hospital for services when they could get their health care while being at home, not being exposed to all of the COVID possibilities. So I had this bill that I had authored that would allow HHS to waive telemedicine restrictions during an emergency, and it just became it became good public policy and a smart move to put that into one of the early COVID relief bills. And in working on this legislation, I found a number of like-minded individuals who understand how important telemedicine is, and we started that caucus to continue to educate our colleagues and to continue to advocate for expansion of telemedicine.
That actually brings me to my next question. Your legislative work around telehealth. You and other House members voted overwhelmingly to pass 416 to 12 a telehealth bill in July to extend the flexibilities associated with the public health emergency through 2024. And you were actually co-author on this bill as well. But the Senate hasn't taken it up yet. Obviously, we're running out of time. We're at the end of the year. What do you see as the barriers there, and why isn't the Senate taking this matter up when telehealth is supposed to be a bipartisan issue?
Well, it's not supposed to be. It is a bipartisan issue, and it's an important issue. As you know, Congress is a strange place, and there are any number of bills right now that you and I and probably your entire viewership would agree should be passed. But for a number of very complicated reasons, they're lingering, this being one. My bill, the bill that you talked about, would expand the provisions of telemedicine for 2 years. Now, there was some rumor that the Senate was inclined to do it, but only wanted to do it for 1 year. And we're waiting to see what the final package comes down to. But you put that right in the on the same page as some of the tax measures that we're trying to do. All things that are important to the American people, and we just got to figure out a way to get those done, along with keeping our government funded and open.
That's actually my next question. I think a burning question for a lot of us reporters. Do you see the possibility of a telehealth flexibility extension being included in this end of year omnibus package? Would you expect that to be 1 year, as you said, or do you think y'all could squeeze 2 years?
Well, I'm pushing hard for 2 years. I mean, we're not unringing this bell. If you look back at 2019, there were about 800,000 people that were using telemedicine to get their health care. In 2020, it's about 53 million people. This works, and it works well. And what they say, the proof of the pudding is in the taste. People are lining up to be able to use and to access and use these services. So we're not going to turn around and go back. The 2-year House bill is the least that we can do. I believe that we should pass my legislation that would make it permanent. And that's where we're going to end up. So yes, as we come down to the end of this Congress, there's going to be a lot of effort to include many things: telemedicine, some different tax provisions, and everybody has their own list of their priorities. So we'll try and get everything that is of my priority in the final works for Congress.
So looking past the public health emergency, is there more action that you would like to see the Ways and Means Committee to take on telehealth next year? And would you anticipate any difficulties now working with a split Congress since Democrats will no longer be in power in the House?
Well, the beauty of telemedicine is it's bipartisan. And I've had strong bipartisan partners on this from the day I first introduced it in the Congress. So I see this as one of those policy measures that could continue to get good bipartisan support. And I would hope that the Ways and Means Committee, whomever is the chair and whomever chairs the health subcommittee, will recognize how important this is and will be able to continue to work together to move this forward.
One of your staffers previously remarked at a telemedicine conference last year that one of the problems with telehealth legislation is that the Congressional Budget Office sometimes evaluates it as very expensive. Do you see that as a potentially another barrier for getting movement on legislation?
Well, I don't see it as a barrier. I just see it as one more thing we have to deal with. It doesn't matter how good the idea is. There's always cost associated with it. So you just have to work with that and figure it out. And I think we're going to be able to explain that and be able to put forward the expanded telehealth, and notwithstanding what the cost of that is, because it's going to pay for itself time and time again. Whenever you can go online to be connected to a doc, you don't have to drive your car to the facility. Or sometimes, as you know, no doubt, if you're in a hospital and that particular hospital doesn't have the expertise that's needed, they can wheel in the computer, and you can go online through telemedicine and put you in contact with the expert that's needed to save your life, to save money. It works on absolutely every level.
One last question. Some of your colleagues have expressed concerns about fraud associated with telehealth usage. What are your thoughts on the best ways to prevent telehealth fraud?
Well, I think that we have to be mindful of fraud, not only in telehealth, but in traditional medicine and everything else where government dollars, taxpayer dollars are involved. This isn't anything new. People have been trying to defraud the government since the day there was a government. And we just need to have good oversight to make sure that doesn't happen.
Thank you so much, Representative Thompson, for joining us today, talking to Axios about telehealth. We so appreciate your time.
Well, Victoria, let me just ask you, do you have time for one very compelling story?
Sure.
When I was doing this work in the state Senate in California, my district included the Mendocino County. It's a coastal county. And we had a situation where a young child needed life-saving surgery. And because of the coastal influence, the weather was terrible. They couldn't do the surgery in the hospital. They didn't have the appropriate expertise. If they were to drive this child by ambulance to the nearest hospital that had this type of expertise, he would have died before he got there. And they couldn't airlift him because of the inclement weather. But they had a doc in that hospital who had observed this very intricate and rare surgery while he was in medical school. So through telemedicine, they linked this hospital operating room up to a surgeon who performs this type of surgery on a fairly regular basis. And they walked that surgeon through the procedure. The young boy lived. And I always remember that particular situation when I'm thinking about how important and examples of how important telemedicine is to the people that we all represent.
Thank you so much for sharing that, and I'll look forward to seeing you in the halls of Congress. Thank you again for your time, Congressman.
All right, good to see you. Thank you very much.
Thank you all for joining this afternoon for another virtual conversation that has made everyone smarter, faster. For more info or to sign up for the Vitals newsletter, visit axios.com/newsletters or the Axios app. Or to sign up for my new Axios Pro healthcare policy newsletter, visit axios.com/pro. Thank you all for joining, and we'll see you on axios.com.